Medicare Part B is a little different. So Medicare Part B is going to cover your doctor services. So think about your primary care visits, your diagnostic testing like MRIs and CT scans, blood work, specialist visits, things like that. These are all going to be covered under Part B. Now, Part B is going to have a deductible as well, but it's going to be different. So instead of a benefit period, this Part B deductible is going to be an annual deductible. And for 2023, that deductible will be $226. Part B does have a monthly premium, and right now in 2022, that Part B premium is $170.10. But starting January 1st, that Part B premium will be $164.90. Now, when you're getting ready to enroll in Medicare, either if you're taking Social Security or you're coming off of an employer-sponsored plan, Social Security is going to look at your last 2 years of your tax return. Ooh, I'm not able to advance yet. There we go. They're going to take a look at your last 2 years of your tax return. So if you are aging in 2022, Social Security is going to look at your tax return from 2020. If you are aging into Medicare after January 1st, 2023, Social Security will be looking at your tax return from 2021. Now, with that base premium, if you fall within certain income limits, as you can see on the chart, you will have that base premium of $164.90. But if you do find yourself in your last few years of retirement and you have a lot of funds, you could be assessed with an IRMA or an income-related monthly adjustment amount. Now, when you do have this IRMA, that's when you will have a higher premium on the Part B side as well as the Part D side. So if for some reason you do find yourself in a situation where your income situation has changed, you are able to appeal that higher Part B and Part D premium through Social Security. So that's something that I do a lot of times before the annual enrollment period starts, helping individuals enroll in Medicare, and then also assisting with those Part B and Part D premiums and just making Medicare work for you. Now, there is a Medicare alphabet that's out there. Just like we were in school, we have a Medicare alphabet as well. So Part A and Part B are going to cover your hospital and doctor visits, and these are going to be administered by the federal government. Part C and Part D are going to cover your Medicare Advantage plans or prescription drug coverage. This type of coverage is going to be administered by private companies. So think about all the commercials that you see out there right now talking about Medicare Advantage plans or some of those extras. Those are referring to Part C. So your Medicare alphabet includes Part A, Part B, Part C, and Part D. When you are eligible to enroll in Medicare, there's a few different ways that you can do that. So if you are going to start collecting Social Security before you're 65, your Medicare card is automatically going to arrive 3 months before the month of your 65th birthday. Now, if you're going to postpone Social Security benefits until full retirement age or maybe even 70, you're still able to enroll in Medicare, but you'll want to do that 3 months before the month of your 65th birthday. That can be done in a variety of ways. You can create an account on ssa.gov and enroll online. You can also visit your local Social Security office, or you can make a phone appointment with Social Security and enroll in Medicare benefits only. If you're currently under 65 but collecting Social Security disability, you will automatically be enrolled in Medicare benefits on the 25th month of collecting Social Security disability. So kind of interesting. There is some situations where people have no idea that they even qualify for Medicare, and all of a sudden a red, white, and blue card just shows up and they're not really sure what to do with that card and what benefits to look at. So little key pieces of information on who's required and eligible to receive Medicare and how to do that. Medicare does have a few enrollment periods, and the most important is going to be your initial enrollment period. So this is the time frame before your 65th birthday. So 3 months before the month of your 65th birthday, that's when you can start taking a look at the options that are out there or enrolling in Medicare. Typically, your Medicare plan will start the month of your 65th birthday, but you also have 3 months after the month of your 65th birthday to enroll in a plan as well. So everyone's situation might be a little different. Some individuals will opt to enroll in Medicare right away. Others, if they're currently working, they might opt to stay on that employer sponsored plan. So remember, it is individualized to your needs. When you are taking a look at your Medicare enrollments, if you are still working and covered by an employer sponsored plan, you do have the option to postpone enrollment into Medicare Part B without any late enrollment penalties. Now, as long as your employer sponsored plan has 20 or more individuals on the plan, you will not have any late enrollment penalties. But if you have a smaller employer sponsored plan, meaning less than 20 employees, you will want to enroll in Medicare during your initial enrollment period or the time when you're getting close to turning 65. If you continue to work past 65, then you would qualify for a special enrollment period and enrolling in Medicare. So sometimes individuals might enroll in Part A benefits only, that's the hospitalization, just to coordinate benefits with that group plan. But you do want to think about what type of plan you currently have through your employer. If you have a family plan, then you would most definitely probably enroll in Part A first eligible. But if you have an HSA plan, you might want to rethink enrolling in Medicare right away. So again, everyone's situation is a little different. But special enrollment periods will happen at any point in time throughout the year. And the most common special enrollment period that's out there is leaving that employer-sponsored plan and enrolling in Medicare Part B for the first time. When you do leave that employer-sponsored plan, there are a few forms that you will want to have from Social Security. First one will be Form CMS 40B, and that is going to be your application into Part B. The next form that you'll want to complete will be CMS L564, and that is going to be given to someone in your HR department, just verifying that you have had creditable coverage through that employer-sponsored plan. So very important to not enroll when you're supposed to, because you could be faced with late enrollment penalties, and those penalties will stay with you the entire time that you're on Medicare. So if you missed your initial enrollment period or you don't qualify for a special enrollment period, then you would have to enroll during the general enrollment period, and you would be faced with a late enrollment penalty on the Part B side as well as the Part D side. So a few things to keep in mind. Just make sure that when you're getting close to that 65 timeline, that you are actively taking a look at your benefits and making sure that you enroll in Medicare when first eligible. If you do have an HSA plan currently through your employer-sponsored plan, you will most likely want to avoid enrolling in Medicare altogether. So Medicare will not allow you to have Medicare benefits, Part A or Part B, and contribute to an HSA. If you are over 65 and you're thinking about initiating Medicare coverage, then you do want to stop your HSA contributions 6 months before Medicare kicks off. Otherwise, you could be faced with some tax ramifications. But again, always a good idea to consult with a financial planner or tax attorney when it comes to figuring out those timelines. If you're working past 65, you have a few choices, and that would include either staying on your employer-sponsored plan or enrolling in Medicare. So everyone's situation is a little different. Things that you want to think about are how much that plan premium is going to be, and then also if you have other family members that are on the plan. When you are ready to explore those Medicare options, there's a few different ways that you can do that. You have a traditional Medicare supplemental plan that fills in the gaps of Medicare, and that would need to include a prescription drug plan. So think of these plans as a la carte. You have to purchase everything separately. Medicare Advantage plans are going to include coverage for all the benefits of Medicare, so your doctor visits, hospital, and prescription drug coverage. You do have to reside in the plan service area, though, in order to enroll in a Medicare Advantage plan. So the Medicare supplemental plans are going to be the easiest type of health insurance to use. These are going to follow the guidelines of Medicare, and whatever Medicare covers, that Medicare supplemental plan will cover. However, premiums will increase over time, so you do want to make sure that you explore all of your options and kind of revisit that plan. If you have a change in health situation or perhaps different medications, you will want to reevaluate that on an annual basis. Now remember, Medicare supplements do not include prescription drug coverage, so you will have to purchase that as a standalone item. Medicare supplements will cover your medical benefits very nicely, but some of them will not include coverage for long term care or custodial care or routine benefits like vision, dental, things that might be on your wish list. So, as you are approaching Medicare, make sure that you understand how your plan works and that you're making the most of your Medicare benefits. The other option is Medicare Advantage, that's also known as Part C, and this is going to include all the components of Medicare. So these plans will be offered by the private companies, and they're going to include coverage for your doctor, hospital, and prescription drugs. Every year, you will have the opportunity to explore different plans, and that's called the annual enrollment period, and that's going to happen from October 15th until December 7th. I like to refer to Medicare Advantage as pay as you go. You still have to continue to pay your Part B premium, but you will possibly have a low to no monthly premium in addition to that. So you are going to pay co-payments for certain services, but you're going to have prescription coverage included. And a lot of times things like dental and vision and hearing aids and over-the-counter benefits will be included with your Medicare Advantage plan. Every plan is going to vary by zip code, so definitely keep an eye on that because there are lots of options. And for 2023, there's a ton out there. It's incredible. If you have a Medicare Advantage plan currently and you're happy with that plan, you do not have to do anything during the annual enrollment period. That plan will automatically renew for you. If for some reason you decide that you have to make a change in your plan, maybe a medication has changed or your doctor has left a plan network, you can make that change during the annual enrollment period, which happens from October 15th until December 7th. And then those plans will go into effect on January 1st. If for some reason you have a change and maybe a prescription isn't covered or you don't have benefits that you thought you might have in your plan, you are able to make a change during the open enrollment period, which happens January 1st until March 31st. Prescription drug coverage is extremely important. This is considered Part D. Now, even if you're currently not taking medications, you want to have some form of creditable coverage. And all the Part D plans will vary by zip code and even by state. So every plan is going to have a different formulary or list of covered drugs, and they're going to break those prescriptions up into different tiers. Well, you don't have to always do an annual review. It is recommended as these plan benefits will change every single year. Unfortunately, if you don't enroll in a prescription drug plan when first eligible, you may be faced with a late enrollment penalty. But if you're coming off of an employer-sponsored plan with creditable coverage, you will avoid that late enrollment penalty. There we go. It's very important to understand a plan's formulary as all of these medications are going to change. So most of the plans that are out there will have a 5-tier structure with your preferred and non-preferred generic being your lowest out-of-pocket cost, and then your tier 3, 4, and 5 meds being a little bit higher. Again, it's going to depend on what pharmacies you're going to use and then also what medications you're taking. Changing Medicare plans can be done at any point in time throughout the year. If you have a Medicare supplemental plan, you are able to go through health underwriting where they ask you health questions and change from one company to another. Most of the time, you're not going to be changing your benefits, but the reason that you move from one supplemental company to another would be to reduce that monthly premium. So you do want to make sure that those premiums are manageable and that all of your benefits are covered. Typically, most people will kind of shop those options every few years, just like you shop your home insurance or your car insurance. You're going to do the same thing with your health insurance. Changing Medicare Advantage plans can be done at any point in time during the annual enrollment period, or if there is a special enrollment period. Those are going to be situation dependent. So most common special enrollment period that people run into is a 5-star rating where CMS rates every insurance company and gives them a 5-star rating. If they have that 5-star rating, they have a one-time special enrollment period throughout the year. If you move from one part of the state to the other and the plan that you currently have is not available, that would also constitute a special enrollment period. So remember, those special enrollment periods are situation dependent. When you are making a plan decision, you will want to take a look at what doctors and hospitals you want to have access to. That's very important as they will vary from plan to plan. The other thing you want to think about is what medications you're currently taking. Chances are you are going to take those medications every single day. You might not be running to the doctor's office very often, but you will be taking your meds. And then you want to think about your wish list or what things are important to you. Are you a high utilizer of dental or do you need some more vision benefits? Do you need transportation or a gym membership? So always think about what's best for your situation. Working with an advisor like myself, I have access to all the plan benefits that are on the market, and I do provide customer service and in-house claim service all year long. So it's not like utilizing a call center where you talk to someone, get the benefits, and then you can never reach them again. I am local in Wisconsin, also licensed in a variety of other states as well. So FHK is here and ready to help. And the best part about working with an advisor at FHK is that we have access to all the companies. So we can compare all the benefits at no additional cost. So really a great resource for clients. And even if you just need additional information or basic information that's out there, well, CMS.gov and Medicare.gov offer wonderful options. It does not hurt to talk to a broker and just ask any questions that you might have. So I thank you so much for joining me tonight. And that was our little Medicare 101. I'm happy to answer any questions that you might have, or if you need some assistance in the future, feel free to reach me at my office at 414-228-7555, or send me an email at njohnson@fhkinsurance.com.
Nikki, thank you so much. That was excellent information. Medicare, you almost need a degree just to understand all the variables, right? So we appreciate the knowledge, the education you gave. So if you do have a question, I don't see anything in the chat right now, but if you do have a question, you can unmute yourself and then ask Nikki a question at this time.
Hi, I have a question.
Hi, Gail, sure.
Hi. So I'm 70, but I just retired the end of July. So I had health insurance through my employer. I had Part A when I turned 65, but
Okay.
so now I'm struggling to even get a hold of anybody at Social Security to answer these questions. That's part of my problem. But I have UCare, a Medicare product with UCare, but I'm getting billed out of my Social Security check. I'm getting billed for $170 and some cents, and I'm getting billed by UCare for the same, kind of close to the same amount. And is that right? I just feel like, is this a duplicate?
Yeah.
What's the deal?
Great question. Yep. So the $170.10 that's coming out right now, that's your basic Part B premium. So everyone pays that that's on Medicare unless they are low income and qualify for Medicare and Medicaid.
Okay.
And then with your UCare plan, do you have any out-of-pocket costs? Is that a Medicare supplement? Is that out in Minnesota or?
I'm sorry, I didn't understand that. What did you say?
Sure. With your UCare plan, are you a Wisconsin resident or are you currently in Minnesota or a different state?
Minnesota. I'm in Minnesota.
Minnesota. Okay. So that could be a couple of different things. It could be a Medicare Advantage plan, but you don't have any co-pays or anything, do you?
I have co-pays for my prescriptions.
For prescriptions? Okay. So when you go to
I haven't been to a doctor. I don't know. I don't know what I'm covered for, honestly.
Okay. So it could be one of two things, because if you're having a bill for $170 and then you have another bill for $170, usually a Medicare supplemental plan like Plan G, that could be a $170 premium. If you have a plan that's all bundled together that covers your doctor, hospital, and prescriptions and things aren't purchased separately, that's a Medicare Advantage plan, but that sounds like a very high monthly premium for a Medicare Advantage plan. So we might want to explore a little bit more, and if you'd like to send me an email, I'd be more than happy to set up a one-to-one review with you just to kind of take a deeper dive into that.
Right. Yeah, okay, thank you.
Sure.
Okay, any other questions? All right, Nikki, we appreciate you so very much. Thank you for sharing your expertise with us today at ClearStep Financial. Thank you, Nikki.
Thank you so much for having me. Have a great evening.
Thank you, you as well.
Thanks.
All right, our next presentation will be, Cassandra, if you can pull up just the Social Security information, that would be great. If you can pull that up on, oh, there's Cassandra. Let's have Cassandra. Let's see Cassandra instead. All right, so we're gonna do it. We're gonna do it a little bit differently tonight with our Social Security. First off, if you have any questions, please wait until the end of the presentation on Social Security to answer questions, or you can put them in the chat. Just click below and put them in the chat. We have to do it a little bit different today because the presentation that we had with the documentation had a little bit of a glitch with compliance because I had a formulation on the bottom. So this we could not get removed. So we are going to do this verbally. We're going to talk a little bit about Social Security and go through some very good information again. So if you have any specific questions, just put it in the chat on the bottom. So Cassandra Brazier is from, again, we have advisors from all over the Midwest. She is a specialty in Minnesota, and she's going to be our presenter. She's a director in Minnesota, in Minneapolis at the Bloomington office, and she'll be our main presenter tonight with Social Security.
Great, thank you. Yep, we live in a very highly compliant world in the financial industry, and that's a good thing. I think that they just make sure that everything is up to whatever compliance standards they have, even if it's just a small little thing. That's okay. We're going to go through some really great information. I've taught a number of classes on Social Security, but there's still so much to learn. So if you do have questions at the end and we don't know the answer, we will do our best. One of us or whoever you're working with the advisor, will make sure someone gets you the answer or helps you find the answer that you're looking for. Because Social Security, like so many things, can be very complicated, complex. And I love getting answers too that I don't know, because it gives us an opportunity to learn as well as we go along here. So real quick, I thought we would start with a little bit of history on Social Security. I think context is very helpful. I know, how many of you celebrated August 14th? Anyone? Maybe it was someone's birthday you knew. It was actually August 14th in 1935 was when FDR signed the Social Security Act into place. So those of you hoping to at one point draw Social Security, just remember that every August 14th when it rolls around, that was a historic day we can all celebrate. And that's why hopefully all of us at some point will be collecting Social Security in one form or another. So that was when the ball got started. And it was, if you can imagine, close your eyes for a second and imagine you're back in 1935. The reason that they really went to this was because about 25% of elderly American citizens were in poverty. They were going through the Great Depression era. There was a lot of difficulty. And so they wanted to find a way to at least ease that financial burden for older Americans. So it was never meant to be the primary source of retirement for people. It was meant to at least help people at least somewhat, where they might have had a pension as well, or maybe some personal savings. Again, you go back historically. Yeah.
People only lived until 65, 70 at that time as well. So the longevity, the age, so they didn't see it as a big risk to add Social Security to the benefits because people didn't live that long.
They didn't. No, absolutely. And like I said, it was only meant to help kind of just add another layer of income. Most people back in 1900 had pensions and so forth for their retirement. So those were a couple of things there. When you look at then what does it take to be able to qualify for Social Security? So there's a few ways that you can do that. Really, you have to have either you or a spouse have at least 10 years of earned income where you're earning at least about $6,000. Now there's different ways to piece it together. It doesn't have to be 10 years consecutively, but it does need to be at least 40 quarters. So again, that could be at different points in time, but that would at least qualify you then for Social Security. Now, most people have more than 10 years of work experience. So what they do is they look at your top 35 years of income. And because they do that, and because how many of you, your last number of years were the highest, right? Your income kind of climbs and climbs and it climbs and it goes up, or maybe it's going up exponentially, which is wonderful. But how many of us our later years are our highest earning income years. And for that reason, you want to make sure that you are checking, going online if you're able to, because otherwise I'm sure, Gail, like you were talking about trying to get a hold of someone at Social Security, I'm sure you might be able to verify that your income is being recorded at the Social Security Administration correctly, but you don't know if it is or not. That's why you want to go online. So you want to go online if you can, and it's probably easier than calling them. And you go online and you verify that they are recording your income every year accurately. Like I said, especially the closer you get to retirement. And if you see a year that's missed, I've seen people's Social Security statements where there's a gap of a couple years where it shows no income. And I'll say, well, were you out of the workforce? No, I was working. Well, then they need to go back and make sure that that income gets recorded, because that will impact what your Social Security benefits are likely, especially if it's in those later years when you have the higher income more often than not. So those are just a couple things on that. There are, of course, there's all different types now of Social Security, and it could be a survivor benefit. So for families that if there was a tragedy that happened and there's young kids that are dependents, there are Social Security benefits for that. That's not our focus today, but that's obviously another area. One area though that I do want to talk about is widow benefits, because that can kick in for people at 60. So there are a few criteria for that. But if you were married and then you lost your spouse and then you turn 60, you're able to qualify for widow benefits. So that's again one of those things that if you have questions about that, or if you're wondering if that's something you would qualify for, we can help kind of talk you through some of that. One of the advisors here at, in our office. There's also different strategies depending on, again, if you're married, and then how you would do that with your spouse. Now, because we're not going to be going through some of the charts right now, what I would recommend doing is talking with the advisor that either you work with, or reach out and we can help, get you connected with one of the advisors in our office to do a little bit of strategy on Social Security if you have questions about it. Because nowadays, what we're seeing is about a third of people are choosing to collect what they consider early, or the earliest would be around 62. And then the next highest number we see is right around 66. And then it kind of tapers off after that. But most of you are probably familiar that 62 is the earliest you can draw. 70 is really, it doesn't increase after 70. So there's no benefit to wait any longer than 70. So 70 would likely be the longest you'd choose to wait. But at 70 is what they call where you maximize it, or where you get the highest possible payout of your Social Security benefits. What they do is they look at whatever your full retirement age number is. And most of you, if you're getting close to Social Security, you probably know what that age is. I know, Mom, what were you telling me? You knew yours. What was yours? You're 66, and I think you said, what'd you say, 10 months?
Oh, well, that's just my birth year is just
Right.
under 67.
Right.
And 10 months.
Right. So there's this window of time of a few years before we get to 1960 that they give you 66 in a few months and a month and a month. So basically, depending on when you were born, determines what your full retirement age is. At that point, that's basically the baseline. And that's where they would say, this is your FRA amount, your full retirement age amount. So for you, Mom, at 66 and 10 months, your full retirement age amount would be set and determined as you got closer. And then for every year you waited, if you waited till 70, they would increase that every year by 8%. They would increase your benefit. And they prorate it by the month. So if you waited half a year, you'd get half of that, right? But if you were to start taking it earlier than your full retirement age, then they subtract 7% for each year that you take it early. So they use, like I said, that full retirement age is good to know because they use that as a baseline number. And then they increase it by 8% the more you wait, and they decrease it by 7% the sooner you take it. So again, that's a pretty simple explanation. Now, let's say that someone is divorced and they were married before. If you were married at least for 10 years, you're able to take Social Security benefits based on an ex-spouse if half of their full retirement age benefit is more than what you would have for your benefit. So if that makes sense to people, if you were married at least 10 years and now you're not married and you're going towards Social Security age and you're looking at what are your options for drawing, if you had a spouse that had a higher income than you did, an ex-spouse now, that could be a way that you would be able to receive a higher benefit. And that doesn't impact the ex-spouse. If they are remarried, they could also potentially have someone drawing on their Social Security benefits for the spousal benefit. And the way the spousal benefit works is just like what I explained. If you're married, and let's say there's a discrepancy where one person maybe had the higher income throughout their working career, and so maybe their Social Security benefit is higher. So if that's the case, the spouse can qualify then to take half of their spouse's benefit, full retirement age benefit. And so let's say, for example, if the one spouse who had the higher, maybe it's 3,000 was their full retirement age benefit, well, then the other spouse could take 1,500. Maybe their benefit was 900. So if they're able to take 1,500, then they're able to do that off of their spouse's benefit. So hopefully that makes sense, because there's ways to draw benefits. They will give you the higher of the two, yours or half of your spouse's. And then if a spouse passes away, if the higher spouse passes away, that higher benefit will go to the spouse that's still surviving, but then their benefit drops off. So if it was 3,000 was the higher benefit, and then the other spouse was getting 1,500, if the spouse earning the 3,000 a month passes away, then 1,500 a month will go away, but that other spouse will continue to receive that 3,000 a month, if that makes sense. So those are a few of the things that are good to understand with Social Security. So again, we can talk big picture and conceptually about, is it better to wait? Is it better to take it as soon as you're eligible to? And some of that can come down to a philosophy. Some of it can come down to what you're comfortable with. Some of it might come down to, do you have longevity in your family? Some of it will come down to, what does the rest of your financial picture look like? There's so many variables. So the other part of it too is that we don't know what changes might happen to Social Security after 2030. So when we get to this point where we have so many people on Social Security, which we've never had before, we'll have the baby boomer population, which amounts to about a third of our population, and they'll all be retired at the same time. And so we've never seen those kind of demographics. And if you couple that with the fact that we have fewer people that are paying into Social Security now, and then we also have an astronomical amount of debt that the interest continues to raise and raise and raise over time here right now. So that will have to be covered somehow from our taxes and so forth. And then, like I said, the amount of drawing, and then Medicare, because that's another huge expense for the government, is Medicare, is all the healthcare costs, right? So how many of you can see, just from even looking at some of the Medicare information, that healthcare is going to be expensive in retirement? So it's good to see those pieces and be realistic about what might go on in the future. There may need to be some adjustments. Now, we don't know what those are going to be yet, but I think it's good to have those conversations about what might Social Security look like, what might they do? And they might do a few different things. They might do a combination of things. We don't know. They may try and push out when people can draw Social Security who are younger. So they might try and incentivize them to wait longer, or even force them to wait longer. They might add some additional tax. They could do that for people who are working to try and increase the flow of funds that are going to be going towards Social Security. They may do some means testing where if people have assets, they may say, well, you may be penalized or taxed more if you have some assets that you could be living off of instead of Social Security. So we're not quite sure, and they might do a combination of those things. So my guess is that Social Security will be there, and I would hope that for the people that are approaching it and that are at very close to it, that it won't change drastically or won't change very much. For people that are 10 or 15 years from drawing Social Security or more, they could potentially see some more significant changes. So when we look at how to plan for people that are a little bit further away, I think most advisors have the philosophy that they don't typically use 100% of what their estimated benefits are. And some people even closer say, well, I'd like to factor in less and just see if we get it, that's great. If it's not there, then then we're okay because we didn't plan on it. But so I think part of it comes down to what your philosophy is about, how much you want to factor in Social Security if you have more of a time frame between now and when you're going to be drawing it. We will get to questions, but I think some of the biggest things have to do with looking at your financial picture, because how much you're drawing and living on and your taxable income will impact your Social Security. For most people, I would say, most people, you'll see your Social Security taxed, which, Mom, weren't we talking about this? It's crazy to us because Social Security, that was a tax you paid, right? Your employer, if you're employed, your employer paid some, you paid some, you contributed, it's right on your statement. It shows you how much you contributed.
It's a little frustrating because it's double taxation and that's unconstitutional, right? So you paid Social Security already through your employment.
Right.
And now there's a good chance you may get taxed again because it's means tested, which means you earn a certain amount, or you take money from an IRA because that's 100% taxable. You could have up to 85% of your Social Security benefit taxed.
And you don't even have to make all that much for that to happen. You really don't. I mean, I think what a married couple, if you are living on over 44,000 a year, which most people need to, just, for their living expenses, not anything extravagant, but up to 85% then of your Social Security will be taxed. So after you've paid for your Medicare and so forth, that comes out of your check, like some of you are familiar with, and then you're covering the taxes and so forth of your Social Security benefit that was a tax, then you're just going to get less. That's just the bottom line. So even though we've seen some of the highest increases here recently, this year, I know it was up, almost 6%. And I think they're also projecting next year that it could be up with inflation, cost of living expenses, it could be up around 7%. We'll see how that shakes out. Historically, though, it's usually only increases about 2.4% is what it usually averages. And it's almost laughable right now when we look at the cost of things and how much things have risen. How many of us have seen anything that we buy regularly go up 2.4% in the last year? I think most of us have seen most of the regular things we purchase have gone up quite a bit more than that. So it's funny that that's really the average number that Social Security usually increases. That's actually another thing that they talked about possibly changing, is lowering how they factor cost of living increases. So if you can imagine them increasing it less than 2.4% average as one of their solutions for trying to figure out how to continue to keep Social Security more solvent. So it is really interesting and fascinating, and it'll be interesting to see what the solutions are that they do come up with. But
So
I will say, go ahead.
Social Security is an unfunded liability. So the Social Security tax that goes into the big pot of the government goes right out again. They use it for other sources as well. They tap into it. There's no big pot there. There's no savings. It's an unfunded liability. And so, like Cassandra said, we have 1/3 of the baby boomers right now. In just a few years, you'll have 100% of the baby boomers will be on Social Security. So there's some concerns, but there's also, we're starting to see some possibilities of some changes taking place sooner than 2030. And if that is the case, we could go either way. We could work it out where the benefit may be a less benefit, or like Cassandra said, they may not, inflation might be 5-6%, but you might get an increase of 2 or 3%. So that's one direction. The other direction is they could restructure the whole system, and then there could be some strong benefits in Social Security if it were restructured. So we'll see where
We have to,
we
right?
head
We have
with.
to, yeah. Yeah, you're right. I mean, there's just so many unknowns. Just to at least let people know though, without any changes right now, they still, I don't know, I haven't run these numbers and I haven't lifted the hood or pulled back the curtain on Social Security. They don't let us be privy to all that. But they have said that without legislative change, it still would be able to fund about 3/4 or about 76% of the benefits through 2093. So for what that's worth, hopefully they'll be able to make some of these changes, whatever they look like. Now, if you're on the fence and you're thinking, I don't know if I should draw early, if I should wait, if I should postpone, they do have a few tips as far as maybe ideas for people to help guide you one way or another. Like I said, but there are so many factors that go into this. But they do say if people do have a shorter life expectancy, like we know, right? I know we were joking about that because women and men tend to underestimate their life expectancy by an average of 5 years. And so it is funny, but women do it even a little bit more than men, I guess, underestimate how long they're going to live. But what do you usually say? A married couple who is 60, they have a pretty good shot of one of them being 90,
So
right?
interesting, if you have a married couple and they reach age 65, the age of 65 is an interesting age because you have a greater chance of living longer at age 60. If you're married together at 65, one of you has a very good chance of reaching age 90 into your
Right.
90s.
Right.
Life expectancy is shorter if you're under 65, but once you reach that age, it actually is longer.
I know, it's one of those things, the longer you live, the longer you may live. So we look at then, if you have, well, if you don't, I should say, if you don't have longevity in your family, now it doesn't mean that you won't live a long time. So I think that's a funny thing to say, that you could look at that as a guideline for maybe, drawing Social Security earlier, but different risk tolerances come into play. Those who tend to live longer are married couples, women, and just people, again, with longevity or certain lifestyles that are able to do that. But again, we could go at any moment, and we don't know when that's going to be, and it could have nothing to do with our health. So it's interesting to look at some of those things. I still say you got to really look at the full picture, look at what your financial situation looks like. For those of you that still have some time before Social Security to do some planning, Roth IRAs can be a great tool to help offset some of the taxes and so forth. And like she was talking about with Medicare, those expenses can be, they're factored into what your income is. So to be able to help offset taxes and things in retirement, those Roths can become very, very nice, and a nice tool to have that can help keep more of your consistent expenses and things on an even trajectory, instead of having specific things that might be just a 1-year increase, because that can, like you saw, can impact what your Medicare expenses might be, potentially then your Social Security and how much it'll be taxed. It can have this whole domino effect on what other things happen as far as what the expenses are in retirement. And it's not fun to have some of those surprises if you're not expecting it, just because you had 1 year where maybe you took the family on a trip or something, or maybe you just had this year where you spent a little bit more than normal. It's nice if you can have a Roth to take some of that extra spending from, that doesn't throw off your taxes as much in retirement. Now, we are not tax experts. We'll talk to your tax advisor on some of that. However, we do understand, how how some of these different retirement vehicles work. So just a couple more things here, and then what I was going to say is we can go to some questions. I was going to say to one thing that I think is interesting, that if you want to know where your break even point is, typically if your full retirement age, this is just an example, someone who was born in 1956, if their full retirement age then would be 66 and 4 months. And so assuming that, and assuming their benefit at their full retirement age would be about 2,700, if they were to take Social Security at 62, their break-even point would be at 79 when they turn 79. So after 79, that means they would have been ahead if they would have waited to take Social Security, but they would be ahead up until that point. So for 17 years of drawing Social Security, they would have more until they got to 79. So I think that's interesting to note. If you waited until 70 to draw your Social Security in this example here, then at age 84, that's when you'd start to be ahead. And that's when you would have been able to have more after age 84 and beyond. You'd be, you would have basically drawn more than you would in other situations of drawing earlier than 70. So those are a couple things. Again, when you look at Social Security, it's such a complex, system and so forth. I highly recommend on an annual basis getting online. If you haven't gone, go to Social Security, ssa.gov, G-O-V, and create a login if you haven't. It's very helpful. They even have a tool that you can see if you qualify for benefits, like if you are a widow or a widower, or if you lost a spouse and you have minor children. If you worked for the railroad, there are certain provisions. If you had government pensions and things, you might have a little bit of a lower benefit. There's a few different cases and scenarios that are a little bit of special circumstances. For most people, though, that it's pretty easy. And for advisors, it's pretty easy too for us to take people through and look at and say, these are your options with your financial situation. This is how we would look at it. This is how we could plan. These are some different strategies, and just piece it all together. It's really about putting the puzzle pieces together so that you have peace of mind, so that you feel confident moving forward and you know what your retirement is going to look like. And it's good to have options. I always recommend too, have flexibility within your plan. Make sure that you have some options and you're giving yourself the ability to shift if you need to shift.
So a couple recommendations here. Number one, sit down with your financial advisor at ClearStep Financial and find out what the best solution would be, when to take it. A lot of times my recommendation is if you're going to take money out of your IRAs, then it's better to take your Social Security, because that money should go to your family if something happens to you. So, but again, it depends on if you're working or not working. The other recommendation is, if you are going to call Social Security, call at 7:30 in the morning. They are open on the East Coast at 8 o'clock. So that would be Central Time, 7:30. I'll give you that number for those of you that do want to call. You only have about a 15-minute wait. The earlier in the morning, the better. You can call at 7:15. You might have a 10 or 15-minute wait. Every hour you wait after that, you add on, you might be 2-hour wait in the afternoon. The number though is 800-772-1213. So 800-772-1213, and call. You can schedule a time, but it is easy. If you want to log into Social Security and begin your Social Security benefits, make sure you begin that process at least 3 months ahead of time, because it takes sometimes up with COVID. After COVID, it takes up to 2 months sometimes to get your application processed, but you can do it online. It's a pretty easy process. Follow the promptings and you could get that started online, and it asks for the date when you want to get it started, and it's a pretty easy process.
Mhm. So any questions? Any questions? If you have specific questions about your Social Security benefits, it would be good to talk directly with your advisor about those because they'd be able to give you specific recommendations. But if anyone has any general questions, general Social Security questions, if not, I can leave you with kind of a fun story about the very first person who collected Social Security, and her name was Ida Mae Fuller, and she was from Vermont. And she paid into the system for just a couple years, retired in 1940. She paid in, I want to say it was like $23, something like $25 maybe. And then when she started collecting in 1940, you can actually Google her name, Ida Mae Fuller, and you can see a picture. It was this PR moment for the Social Security system, and they have a picture of her with her paper check, of course, right, because it got mailed to her. And I think it was about $22. So she paid in over the course of 2 or 3 years about $25 or so. Her first check was about $22. So then from then on, right, then she made more than what she put in. But what's funny, like we talked about life expectancy at that point, a lot of people didn't live much past 65, and she lived to 100. She died in 1975, and she drew thousands and thousands and thousands of dollars from the Social Security system. And she's kind of an anomaly, but I think it's a fun story, and it's neat that she was the very first person to collect Social Security, and she lived to be 100. So we never know, right? The odds would have been against her. I don't think anyone would have expected that, but it's pretty exciting. So so there's a question, Lori, where can we find the break even point of age depending upon when you start taking Social Security? So when I talked about that, that was for kind of a generic example, Lori. But if you talk to your advisor, we have access to some different Social Security analysis tools that can tell you when your break-even point would be depending on when you draw Social Security and what your dollar amounts look like. So that is something we can absolutely tell you for your situation. For the one I gave, that was just an example. Good question though, because sometimes that helps people look and make decisions on when they might want to start drawing their benefits. Other questions? Absolutely. Mom, anything else you'd like to add?
Social Security is there to take. It's a benefit. We paid into it all our lives, and it's there ready for you when you're ready to retire. So some people will say, well, I want to delay my Social Security because I wanted to grow to my full retirement age of age 66, 67. And this is just me personally. This is no opinion. This is working with a lot of people that retire every day. And I'll look at them and say, if you're going to take money out of your IRA and not take it from your Social Security, do the opposite. Take your Social Security, you're retired. As long as you're not making more, but before full retirement age, as long as you're not making more than the $19,500, that goes up a little bit every year, then it makes sense to take your Social Security benefit. That's what it's there for. It's there for you to take and give you some security, give you some peace of mind. Hopefully it's secure. We'll see how the benefit lasts and the changes that it may go through in the future, but it's there for you to take as income.
Yeah. If you're working full time though, and you're not at your full retirement age, you may not want to take it because you will likely get very little of it. If you make above 19, 20, let's say 20,000, if you make above 20,000 and you want to start drawing Social Security, most of it will probably be withheld from you. You may only see a very small portion of it until you get to your full retirement age. And that's, again, if you have specific questions about that, your advisor can help kind of explain and look at what that would look like for you.
Do any of our advisors want to make a comment? We have a number of our advisors on the call as well. We have the best financial educational advisors in the Midwest. Do we have any commentary from our advisors?
Well,
Okay, well,
Right,
we are,
Kimmy? Well, I appreciate everyone being on here. This was it was a fun topic to talk about, and we have some fantastic advisors. So I would say if you have any questions about Social Security, if you have a loved one that has questions about Social Security, our advisors are very, very well, they're very well versed, in this and can help you with it. Can you
Okay, so-
contribute to Social Security funds to an IRA? So Lori, that's a really good question. And that would somewhat determine on if you were working or not. You have to contribute to an IRA, you have to have earned income. And if you were not working and retired, you wouldn't be able to contribute to an IRA directly. I would say talk to your advisor because they'd be able to give you the specifics, but you have to have earned income to contribute to like a Roth IRA or an IRA.
but you could take it and invest it in an IRA and get the tax deductibility if you have earned income.
If you have earned income, correct. But you still could, I have some clients that take it and just invest it, not necessarily in an IRA. But once they're retired, they can take it and just invest it and save it if they don't need it right away. And then they just have more funds at their disposal that they control and that they have access to for whenever they need those.
So just know an announcement here too. We have a Women in Investing webinar on Tuesday, November 8th at 6:30 to 7:30. So we hope that those women and men are welcome too. It's going to be a fun investing seminar, and we'll talk about all different aspects of investing and just some of the pieces of information, some of the details.
Mm-hmm. Absolutely. Wonderful. Well, anything else that you have? We're up on the hour mark and lots of information, lots and lots of information. So hopefully people were able to take it in bite-sized pieces and it made sense. And we really are focused on education. We want it to be understandable and beneficial for people.
Thank you, everyone. Have a wonderful evening.
Thanks so much.